Of course, anytime. I don't know, I just have WhatsApp on my phone, so it just like shows up little pictures and then it has like words on top of it, and I got confused. I don't use WhatsApp very often.
Cool. Oh, the touch. Here we go. All right.
Like, can you all see that screen?
Yeah.
Cool.
Mm-hmm.
Just trying to move. There we go. So yeah, I'm just going to go over the
Wait, I have a question.
Yeah.
Is that, I don't know, it looks different than the article, than the link.
Yeah, sorry, I probably did a screenshot of half of this page. So you're only going to probably have on the WhatsApp see this half of the page that I'm.
Wait, is that a different article?
It's the same article, but so this
Oh,
like you would have only seen half of that.
Wait, okay, never mind. I don't know. Just
we'll just go with it. We'll see how this plays out.
It's fine. It's fine. Mine doesn't have pictures, but it's fine.
Hopefully we're reviewing the same article. Otherwise, it's a bit fun.
It has the same title, so
yeah. Okay. Maybe in America it's just different.
No, it has a different author though.
Okay.
Okay. So yeah. So the stuff that I'm going to be reading out is a guy's review of that article. So I'm reviewing this guy's review.
Okay.
Okay. All right, we got there. Cool.
We're good?
Okay. Yeah. Okay, I got it.
Yeah.
So we're going to be looking at the effects of sport massage on performance and recovery. It's a review of a review of a review of a systematic review. So let's get straight into it. So sports massage is a commonplace in elite sport and becoming increasingly popular at the amateur level. While the proposed benefits of massage are impressive, the practice is time-consuming and resource-intensive. And with athletes always searching for a competitive edge, the self-massage and recovery industry has exploded in the past decade. Foam rollers, percussion guns, these tools are ubiquitous in training rooms, clinics and gyms across the world. We've seen the rise of massage guns and whatnot, and everyone loves them. Everyone, foam rollers, everyone's got a foam roller at home.
Sorry, I'm just reminded of our client that just insisted. Remember when you were here, that the person that came twice a week, literally for the massage gun, and this person had a few other issues. But yeah, it was all about the gun, wasn't it? Excuse me.
From proponents of a massage cite a wide range of benefits at both systemic and local tissue levels, while suggesting the net effect of these benefits can lead to decreased rate of injury, improved recovery from injury, and increased performance. The authors of this study performed a systematic review and meta-analysis examining the effect of massage on measures of sporting performance and recovery. Any early thoughts or?
Interesting. What do we think about massage in general? Does it have a place? I mean, it's a really controversial topic because, as we know, modern day physio, there's a lot of research saying manual therapy is temporary and pointless, which I disagree with. But yeah, I'd love to hear. Why don't you go first, Jack? What are your thoughts? Get us going, then we get the Americans in. Oops, we just lost you.
Yeah, I think it's all individual. Am I here?
Yeah, you just jumped off for a sec. Yeah, you're back. Yeah.
I think it's all individual preference. With massage, like if the person thinks it relaxes relaxes them, improves their performance, improves their recovery. That's one's seeing the value. If they like it, they like it.
Yeah, I think there's a place for it. Yeah. Nat, you want to go next? Yeah, just the initial thoughts about massage, and before we get into this study, and what your thoughts are.
Yeah,
in
sure.
your clinical experience. Yeah,
I agree with Jack. I also think it can kind of also be a gateway to building that bond with your, like that kind of like that trust with your patient. But I think it can also be overutilized, and a lot of patients become overly dependent on it sometimes. And instead of like doing exercise, for example, which has more evidence, obviously, but yeah, overall, I think if it helps, then it helps, right?
yeah, I love it. Yeah, Avi, do you want to finish this off? What are your initial thoughts on massage in the modern day and age?
I think that it kind of depends on like what your goal is and the individual patient. I mean, there's some people that will benefit from it and some that won't. And yeah, I mean, I guess it also just depends like how long you want to spend doing certain things in PT, whereas like, is it like a skilled service or can they just go to a masseuse? I guess like it just depends what your goal is and like why you're doing it.
No, I think it's a great point just at the end there, that skilled service part. You know, we're not, as you know, we've shifted a lot. We probably did way too much manual at the start of we being me, sorry, I don't need to speak in third person. I did a lot of more manual than I used to, and I certainly have been transitioning a lot more across the self-management. And if you can teach your people how to use it, I think it is important, but don't, at the same time, like I think we've all said, don't throw the baby out with the bathwater, because it can be a great tool to actually help them get on top of their goals and help them work towards what they want to achieve. So yeah, it's very individual. Riley, just as a non-physio, do you have any thoughts about massage just being treated, I guess, versus not? Did you just
if that really says anything, but
yeah.
Oh, can you hear me?
Yeah, you just yeah.
Okay. I think it, for me personally, I love it, but I don't know if it does much good. I think it's more in my head that I feel like it's doing better than it actually is. But yeah, I don't know.
And I think, but that's a really interesting comment in itself. So if you were told by someone to just come in and do stuff without understanding the why not feeling better, would you be more likely, if you felt good after a little bit of massage, to do what they said?
Yeah.
Probably. It's just everything in its context, I think. But yeah, keep going, Jack.
That's it. Context is key, I think.
Yeah.
So the methods of this study, they used the Prisma system to gather and assess relevant articles. Self-massage and joint manipulation techniques were not considered. Inclusion criteria consisted of massage performed by a certified massage therapist, study randomization, and the assessment of variables specific to performance of recovery. And so the results are on the other side of the page there in that graph. The summary of the results: massage was not found to create significant improvements in measures of performance. Massage was found to provide small benefit in reducing or preventing DOMS, so that post-exercise soreness. And massage was found to provide a small but significant improvement in flexibility when compared with no intervention, which is that graph in the corner there. So the results from this study should be interpreted cautiously. However, research on massage and DOMS utilises subjective pain ratings as a primary outcome, and is highly prone to the placebo effect, which is sort of what Riley was touching on, I guess. Furthermore, the effects of massage on flexibility has not been shown to be superior compared to passive or active stretching. So you could theoretically do passive or active stretching on your own and have the same results as paying $100 for someone to do a massage and get the same flexibility outcomes. Massage was only shown to be an effective intervention for improvement in flexibility when compared to. Oh, I've already said that. Sorry. Any thoughts on those sort of results?
Yeah. I'll go first. No, it sort of makes sense, of course. I think it also relays the importance in not over servicing the massage. Like I know we're getting better at. I remember one of the key moments for me, Avi, when you were here, is when we started treating shoulders and just went straight to the exercise room. I think that was a pretty big moment for us because we've never been used to that. But it's good and important. We don't want people to get too reliant upon it, which is why there's no reason to have, I think, Jack, us having the standalone sessions with massage and saying, this is just what you're doing and what you're paying for has actually been really good. Because it means when we put our physio hats on, we're very clear in what we want to achieve. I make reference to the active and passive stretching can achieve similar or the same results. Just relies upon the importance in educating our patients on how important it is to do simple things like that. I think that was really cool. And controversially, I'll talk about the placebo effect, I guess, because it's an effect. It's important. So we need to work towards that. And as you know, what we really double down on is effective communication to help our patients, do the work and do the exercise, encourage them to achieve their goals. So yeah, I think obviously very, the results sort of make sense to us, but it is interesting that there are just there's small little benefits there. So it's not to be thrown away, I think. Yeah.
Mm.
Who's next one?
Yeah, no, like there's still, small benefits there. And, even though I was saying that the pain ratings can be placebo, but you got to be working with the placebo effect. It's not a bad thing. You're not tricking anyone. You got to be using it to your advantage and working with it, I think. And, if people like it, then it's not, that's good. That's where we can help them by utilizing that.
Absolutely. Avi, do you have any thoughts on those results or anything that jumps out at you?
I mean, I think most of it kind of just makes sense, but well, I guess this is all based on like sports activities, because I feel like I personally have never really, I don't know, I've like done it for sports, like done massages on people for sports purposes, not for like people that were like injured. But I feel like if you're doing like, I'm sorry, I totally just lost what I was gonna say. I mean, like the pain response and placebo is interesting, but I think that would probably be more helpful for people that are coming to PT with like injuries rather than healthy people that just have muscle soreness from working out.
Yeah,
personally, I don't know.
Yeah, and that's a very good point.
I don't have much experience with it though, with like healthy athletes.
Yeah, it's why I find this really interesting. And healthy people with DOMs aren't going to be seeing physios, so that's something we need to keep in mind as well. So yeah, minimal thing with DOMs, but most sports clubs have massage therapists on hand to do that. But it's more about like what you said about the pain science and working into that, because perception is very important. So I know it's not pure massage, but I think when you're working with those populations, it's why the education is so important. And we can't, don't give away the magician's secrets, but we can't actually solve the world with our two hands, unfortunately. We don't have magic hands. Sorry to burst your bubble, Riley, but we don't before you even get into PT school. But we do have a skill set and able to help people to get better, and it's a combination of a lot of things. But yeah, thanks for those thoughts. Nat, do you have anything to add?
Not really. Sorry.
Yeah.
Yeah, I think you guys are touching some good stuff on it. So
Yeah.
if I think, I'll add to it.
Yeah. If you think of anything, let us know. Riley, you're the same, but essentially, like you said, those results make sense to me, and it just reminds us to put it into perspective and not to overdo it. I think is the most important thing, because intervention is really, really important. Cool. Keep going, Jack. Awesome.
So some limitations. One glaring challenge when studying sports massage is a wide array of protocols and lack of standardized practice. The effects are, the effects of massage on any of the 7 variables, which is back in this paragraph here, studied is likely too small to be detected with the small sample sizes and low-powered studies performed to date. A systematic review is only as strong as the individual studies it is comprised of. Despite being the largest review to date by a factor of 4, this study leaves many unanswered questions in regard to utilisation of the end effects of sports massage. So some
questions and answers.
Yeah. Moving on to some clinical implications to put into our practice. Although return on investment with massage remains questionable, the practice retains massive popularity. It would be remiss to discount the effects of the entire massage experience. Massage is ritualistic, with music, relaxation and meditation like theatrics being hallmark features of some practices, like ours. Massage can also be quite tribalistic, with its most loyal supporters confident in their own anecdotal experiences and perceived benefits. One interesting area of further investigation regarding massage is its effects on autonomic nervous system. Massage is relaxing by nature. Studies have been shown reduced heart rate variability and cortisol levels. Although intriguing, these findings have not been examined in the context of performance recovery or sports. Massage is also purported to help with recovery via increased blood flow and peripheral drainage, although more research is needed to clarify this effect. Any thoughts with all those?
Yeah, I'll talk about the ritualistic music relaxation meditation, like theatrics being a hallmark feature of some practices. I almost feel bad hearing that sometimes, but it is. I guess it's the why though. Why do we do that? You know, and my thoughts are that by creating an environment where we get people out of fight and flight, we can actually help them deal with a lot of the concerns they have. And girls, we had a bit of a promotion when we reopened after COVID, and we got a heap of people coming in for massage, which was cool. So no one wanted to see a physio, but as soon as I said massage by physio, we got some people in, which was nice. But a lot of them stayed on after that experience, because what they wanted was massage, but what they actually needed was some guidance and help by physio. So if you see on our stories or Instagrams these ritualistic music relaxation, me really going to the effort of putting warmers that Jack spilt over last week. That was funny. And making nice smells and working with the room. It's to create that environment to help them to relax, and then, you know, help them to build that trust and help them to achieve their goals. So I think that's why I love doing that. And I think the more we can work towards, and this is for the 3 of us, Riley and Jack, having them almost a standalone session, so that physio is a very different experience, and they know that when they have a physio session, they're doing X. I think that's really important. Do you have anything to add on that, mate?
No, I agree, and it's just all about sort of separating the two entities. You know, if you when we had that massage promotion, it's, you know, this is a different session to what a PT physio session would be, and it just pre-framing what to expect, and trying to, like, you know, help guide them in that direction of staying on and being a really good client and achieving some good goals.
Yeah, cool. Harvey, Nat, do you have anything to add here?
No.
No. I know it's very different
I think
in the
it's just
States.
a little,
Yeah.
it's a little different because you kind of have like massage therapists too, or things.
So. We have that, by the way. Like, we definitely have massage therapists. For me, the reason we just an interesting concept why we decided to do that, and it's nothing I've never done that really before, is because during COVID the massage therapy clinics were closed, but people were looking for a massage, so we just sort of connected it. And even I was talking to a client today who I'm treating now as a physio, and she's obviously I'm treating as a physio. That's kind of what I do. But I was thinking more of a physio session. She was talking how she went to her massage therapist and how she wants to build in between seeing us a bit less often, which I said was absolutely fine because I'm not a massage therapist. I'm a physiotherapist, and there still needs to be a differentiation. However, Jack and Ryla, we still have this service that is separate. Like, we're not going to ever really do those 1.5 hour whole body massage sessions. That's not what our skills are for. But we can do short, sharp sessions to help people feel a bit better, and then encourage them to do, maybe standalone exercise sessions. And Jack wrote a kick-ass new management plan, which is really cool. So it's really easy to pre-frame that. But it's a different system over there. So I don't think you'd be able to really do stuff like what we're doing. I feel like we have less boundaries put on us. I mean, the fact that every state has to have a license is crazy. But anyway, it is what it is. Let's not go down.
Yeah.
That's not so.
Some of that also has to do with the billing, because insurance doesn't like to see like a bunch of that you're doing a bunch of massage.
Yeah.
So that's like one big component to that.
Yeah, of course.
You have to be able to justify your services. So like you're not going to have a patient who just wants to have a massage. Otherwise, like if they're not seeing you for a specific reason, then you're not really going to see someone who just is coming in for massage purposes.
Yeah. And look, we don't really want that either. I from my point of view, I look at that as like, you know what I mean? I look at it as a touch-based session where, yes, might be doing some massage. We can talk about their exercise. We can maybe refine some things, what they're doing in their day-to-day life, and give them some guidance around that. So, and that's why, like you said, we don't want it to just be a set and forget massage session. And look, really, none of our clients have stayed on and just done massage sessions, really. So that's testimony to what we've tried to build here as well. They've all converted, or a couple of them came for the cheap session and then buggered off. So, and that's fine. And that's fine too. That's fine too. Keep going, Jack. Let's round it up.
This paper confirms the assertion that massage does not improve neurological impulse or properties of contractile tissue associated with output, i.e. massage is not a performance enhancer. There is some evidence to support the use of massage in the context of swelling or stasis, decreased peripheral circulation, increased soreness, and bouts of multi-day competitions when recovery, relaxation, and restoration of range of motion between events is of utmost performance. So like a round robin type day or stuff like that. For most people, massage is a relaxation technique and a luxury. Despite the small benefit massage may have on DOMS and flexibility, it has not been shown to be superior to active movement and may be both cost and time prohibitive, which I think sort of sums it up pretty well.
I think I just wanted to put it out there, but just going back to that, creating that space, don't underestimate like we've all said, how massage can be a really good tool to try and get more information, build rapport, and help set up what you want to do with a client. I think that's where I think a lot of modern day physios are just racing off into the anti-manual therapy and then just forgetting about that. Look, if you're massaging someone for the whole session and doing it for multiple sessions, that's not physiotherapy. I'm totally cool with saying that. However, if you're using it as a gateway, you're building up rapport, and then you're able to get people more involved in their own journey. I think that's really cool. But not understanding what the process and what they're there for is very important. I think Harvey touched on at the start. What is their goal? What do they want? Like, we treat sporting people. We also treat these lovely clients who just want to have a have the time and the space just to relax and chill, and unwind and be reminded about things they need to do. So I just, I was going to go around. Is that the end of the article?
Yes.
Yeah. So that was kind of my big take home. It actually helped me remind myself why I do what I do. But I think in taking action, I'm going to be even clearer with my own clients about when we do, I'm not doing too many of these sessions, but when we do a standalone massage relaxation session, I think we need to actually change the name of it. We'll go with sports massage this time, but I do like that idea. And then when we actually need to do the physio stuff, what they're here for. Cool. What about yours, Jack? Your take home?
It was probably just more like, so girls, like for this week, we're going to do sort of like a sports massage promotion where we, try sort of speak to our sporting tell and see if they want to try like a sports massage type session with us, similar to what we did with the massage promotion back when COVID started reopening. So I think it just sort of, this sports massage promotion sort of, if we can try and get a new client in, guiding them, see if we can guide them in the right direction and work out some proper goals, physio goals with them, and turn them into some really good patients and achieve some good things. But on the flip side, if they're, just after a promotion and a one-off thing, then not to waste your time with them, and that's cool, and let them be.
Yeah, cool. Arby, any take-home messages?
Yeah, I think just kind of like keep the patient's goals and the physical therapy goals in mind when you're doing manual therapy, or just like anything really, because that's kind of going to guide how long you want to do things for. And I don't know. That's pretty much all I got.
When I ask you a question.
I know.
It's a good answer. It's a good answer. It's a great answer. I totally agree. Would you say, having done internship here, are you more, less, or were you doing about the same amount of manual therapy pre-internship when you get to practice? That's a hard question to put you on the spot with.
Wait, sorry.
With the amount of manual therapy you saw us do, would you say, having spent time in Australia and seeing how we do it, would you be more likely to do a bit more manual therapy than you did prior to the internship, maybe less manual therapy, or do you think does it just sort of depend on the environment? Like, I just wanted to get your thoughts on that, having seen a completely different side of things. Just wanted your thoughts on manual therapy.
I think it will probably still be about the same. Like, I still think that some patients will benefit from it a lot more than others, and depends on like the condition of the patient. So
love it.
I don't know. I think, I think when I started in Australia, you were doing a lot more manual therapy than by the time I left. So.
And whose fault is that?
We were on a schedule. We had to keep to the time schedule.
Otherwise we couldn't drink. I know. Absolutely. No, thank you for that legacy, because I do agree with you. Right? It's a different practice you left to the one that you came into. And that's testimony to the skills that you brought to the table. And I always say, when you leave a place, you want to leave it better than when you came here. And you certainly did that for us, Avi, but then you left us within 2 days because of a pandemic. So thank you for that.
Good times.
Good times. No, great feedback. I love it, because you did answer the question. Look at the person in front of you. You're not going to treat, and you've seen a few of the people on our wall of fame, Riley. Like, we have a lovely lady on our wall of fame who we are a bit more passive with, but she's coming in for that, and that's okay. We're not going to treat her the same as one of her athletes. That's okay. But work with it and do the right thing by her. Love it. Riley, your take home?
Probably just like what everyone else has said. I don't really know if I have take home. Probably right. that like massage isn't as important as I thought it was.
I was hoping you'd say that. I think before you go into physio school, you just think that it's all we do, but it's so not. There's a good meme about that. It's like what people think we do, what we actually do with the PT. I think it's cool. And Nat, round us up. What's your take home?
Oh gosh. Yeah, that it can be great for certain people for sure. I definitely think that when I was in Australia, we did a lot of massage because we're working with a lot of footy players and a lot of sports. I also have found that, I didn't bring this up yet, but I found that it can also be different with different cultures. Like some people are less comfortable with it. So that's what I found.
Can you maybe tell a quick story, Nat? Culture, like there's something that comes to mind.
Sure.
I think that'd just be helpful for us to talk about.
Yeah, sure. Last year I did a service trip to Haiti for a week, and a lot of the people that I saw had never been seen by a physio, let alone many health professionals in their entire life. So for them, a lot of their backs were like really in a tensed, they were just very tensed, and it was hard. Like we had to start off with cupping before I could even do massage, just because, you know, their nervous system was just really like, what do you call it? Active, hyperactive. So, yeah, and some people just didn't respond well at all to the massage. So it can also be a cultural thing. It can also be, you know, how comfortable somebody feels with being touched. So yeah, those are just some other things to keep in mind.
No, thank you for sharing that, Nat. That's actually really important. And I think we all need to be aware of those things as well. And it's so glad you brought that up. Jack saw a patient just recently who definitely had a hyperactive nervous system. I think it's a good choice of words. And if you try and massage too hard too soon, you're just going to poke the bear, which is where I don't mind a bit of cupping. An ex-GW student actually taught me the cupping that I have today is actually taught to me by Shannon, shout out, my ex-GW student who did an internship with someone who was really good at it. And the stuff that I utilized, she taught me really well. And sometimes it can just interrupt that hypersensitivity, you know, and give you an opportunity to do stuff. So I love when I used to put cups on someone and put it on Instagram, or the hate I would get in my DMs. Like, I can't believe we thought you were a reputable physio. I'm like, come on, guys. I do it for like 3 minutes and then I do my thing. Everyone needs to calm down. It's good to, you know, with massage. I think that's a really good adjunct, because we used to think about what does massage actually do physiologically. We won't even get into that right now, but, you know, we can't really say it's breaking down scar tissue, it's releasing trigger points. You know, the physiology and the science behind it, we know now is a bit different. So we need to put it in perspective as to how it works. But I'll finish on this. How many ACLs have we got in this done? Is it 6 between the 3 of you? Reconstructions? Because this is what I want to finish on. Arvy's got 2, Jack's got 1. Okay, 5. Okay, 5. All I want to say is with your I know, crazy, right? 5 ACL reconstructions in the room. When you're doing your rehab, was it not a bit easier if someone just got a little bit of release work into your hamstring and into your quads and calf before doing the exercises than not?
I hated it.
Yeah? You hated it?
Like,
yeah.
They would just dig, and it was not like a nice massage. It was like a dig into everything that hurts massage.
Yeah, I feel as though I don't know.
Like me jumping off the table massage.
Yeah. But I thought it was helping, and I felt like it was helping. But, you know, like I do agree that it was easier after the massage to go, or the soft tissue, whatever you want to call it. But it was a bit uncomfortable there. But for whatever reason, it did help.
No, that's good. And Avi, let's not forget, you're a weird unit. Like, you like that ball over the plantar fascia thing. Like, so
it wasn't like a nice massage.
Yeah. No, I completely understand. But I feel it may have helped your rehab. So, Nat, do you want you want to finish this up? What are your thoughts? Yeah, just too traumatic for you.
Oh, actually, I was a little bit like sad that after my second operation, they didn't even do a single massage on me at all.
Really?
I think I got ice maybe, but I didn't get any like electrotherapy. No massage. It was just like exercise, and that was it. It was like.
So there you go.
Did you do your exercise?
Did I do my exercise? Yeah, for sure.
Yeah. Nice. But a good way to finish. Well, thank you everyone for jumping on. That was a really interesting paper. It wasn't as content heavy, which is nice. We have access to a few different things now, so we'll have some new resources to share with you and go. But the Physio Network's definitely got some great stuff there. So cool. I'll stop recording.